Hi everyone, Wendy Copeland here. Just wanted to talk a little bit about trauma-focused cognitive behavioral therapy. So if you are someone that has experienced trauma in your history and wants to work through that and find a way to heal and a way to move forward that's productive and helpful in your life, then I have a strategy that I have been trained in that I think can really help. So TFCBT, or trauma-focused cognitive behavioral therapy, is a treatment orientation that works off the acronym PRACTICE. So that starts with the P, psychoeducation. Would be a time where I'm building rapport with you, getting to know the traumatic event that happened, and being able to talk about what are the common reactions that most people experience when they go through something traumatic. And after we are able to kind of normalize and understand, like, what I'm going through, what are the symptoms I'm having, then we would also differentiating trauma versus drama. Then after that, that's when we would go into the next three letters, RAC, from practice. That's relaxation, affect regulation, and cognitive coping. So relaxation is our physical ability to regulate ourselves when we're dysregulated, learning some coping skills and breathing exercises, meditations, specifically for physically relaxing. Then it's A, which is affect regulation, which really just means all the feelings, right? And so can you identify your feelings? Can you name and express your feelings? And then can we figure out how to regulate your mood and your affect so that it ends up being not harmful, not destructive in your life. We can feel angry, but we shouldn't punch people in the face, right? Like, we can feel jealous, but we shouldn't stalk our ex. Those are kind of the the ideas that I'm talking about. We can feel anxious, but we shouldn't helicopter, hover over our children. So anyway, after A is C, which is cognitive coping. So this is going to be, how can I reframe this? How can I work with these maybe negative little t truths that come after a trauma? I'm broken. Nobody's going to accept me for, what's happened to me in my past. I don't trust anybody. How can I ever heal? How can I ever move forward? All those fears kind of associated, everything is bad, that paranoid thinking, or just the obsessive, like replaying the traumatic event. And so figuring out how to cognitively cope with that, meaning how do we wrap our brain around it, and how do we reframe and try to have better thinking, more helpful thinking, more things that are going to help us be more productive and not paralyze us. So that is our RAC. And so if those skills are intact in sort of your day-to-day coping in life, then after that we will move into TICE, which T is for trauma narrative. That's going to be you being able to write the story, a skeleton version of what happened to you, and then we would process through that in a really methodical way. We would use something called in vivo exposure, where I'd be asking you, what were you thinking then? What were you feeling then? Who, what, when, where, why, or sensory questions. What did you see, hear, taste, touch, smell? Really just kind of re-exposing. So the research behind this trauma-focused cognitive behavioral therapy model is the exposure model. It's, after the first time I see a movie, it's really, really scary. The second or third time I see a scary movie, maybe it's not quite so scary anymore. I know when the bad parts are going to happen. It kind of loses its power, and by the 14th and 15th time you've seen this scary movie, you can have it on as background noise while you're doing your homework or your paperwork for work or whatever. So that's kind of the research-based reason that we do this exposure work, the in vivo exposure to your trauma narrative. And then C is going to be community. So it's really making sure you have a support network outside of our session. After we do the trauma narrative, you're going to be working on creating some new truths and solidifying those through sharing your trauma narrative with one person that's outside of just a paid therapist. Hopefully that is going to be helpful for you. And what I have seen anecdotally in my practice is that it really has been a 99.999% effective in what I have evidence for with my clients. It works. And standing on these new truths and having somebody who loves you outside of therapy who can remind you of these new truths as you move forward. E is ensuring future safety or exit plan for therapy potentially if we're ending the chapter. And so lots of E's there, but that's really the end of the trauma-focused cognitive behavioral therapy model. And that would be the main way I would go about helping. So I hope that's helpful in understanding, this bread and butter part of my work as a therapist. I love this training. I love this theory and this practice. And hopefully I can be a resource. Okay, thanks so much. Bye-bye.